It was not a hopeful time.
Ambulances wouldn't come into the community without a police escort.
There was a lot of fear in the city. There was really no healthcare vision at all.
Going to City Hospital, sitting for hours waiting. You never saw the same doctor, but you didn't have any place else to go.
One long look at Mississippi, and I realized I didn't have to go to Africa or Southeast Asia or Latin America. Poverty and lack of access to health care, we all had that problem here.
Jack Geiger saw community health care as an essential part of the civil rights movement. It began with residents being organized and eventually led to empowering communities in the broadest context of improving overall health. Both doctors Jack Geiger and Count Gibson, who were from Tufts Medical School, envisioned community-based neighborhood health centers that would treat the entire family rather than just isolated medical problems.
So this is Mount Vernon Street. Columbia Point Health Center was right over here. The original grant application that Jack Geiger and Count Gibson submitted was for two health centers, a rural and an urban model. The urban was Columbia Point Health Center, and the rural was Delta Health Services in Mound Bayou, Mississippi. The folks in Mound Bayou ran into a lot of political opposition, and they didn't open until a little bit later. So by virtue of that, Columbia Point became the first to open its doors. It changed the actual community in several ways. It became a focus for community action and community organization, which was always part of Jack Geiger and Count Gibson's original conception. Secondly, it became a place where people could seek employment. And then the most obvious contribution was having primary health care services available immediately in their neighborhood. The first 20 years for Columbia Point were a bit tumultuous. There was some financial difficulties that hit the center in the 80s, and the center was really in a very difficult time.
Even though I was the medical director, I was not totally privy to how bad the finances were. Morale had become very low. Unless another community health center that was also federally funded was willing to merge with us and basically take over the responsibility for the administrative function of the health center, they were going to cut funding completely, in which case the doors would have simply closed and that would have been the end of it.
I went to my board of directors and said, here's the problem. The first health center in the country is in danger of closing. There are people out there who need health care. I vividly remember an afternoon when I had asked Jack Craddock, who was running the East Boston Neighborhood Health Center, to come and sit with us and go over the numbers and see if there wasn't some way to make this work. And we just spent hours and hours and hours going over these numbers, and it just looked shaky. And finally, at the end of about 3 hours, Jack sat back in his chair and he said, Dan, what is it you want to do? And I said, I want to keep it open. He said, then just do it.
I was very surprised to hear that the Neponset Health Center was interested in taking over the management of Columbia Point Health Center.
And there's the Neponset Health Center right there. You really couldn't have found two more unlikely partners than the Neponset neighborhood and Columbia Point. The courage that both sides showed, I believe, was to put aside those differences, to overlook those differences, and focus on the fact that both neighborhoods wanted to have community health services available to their residents. The result was that we convinced the federal government to allow this new unified board of directors to run both the Neponset Health Center and the Columbia Point Health Center. When I started at the Neponset Health Center 38 years ago, there were 23 employees, and the entire budget was under $400,000. Since that time, we've moved on to Cape Cod, we've opened in Plymouth. The work that we do at Harbor contributes to repairing the world.
There are a lot of families where I took care of both parents, and now I'm taking care of their kids and maybe grandchildren. So it's those ongoing relationships that keeps you going.
Today there are about 1,700 health centers in the country. The sense that you are not alone in all of this. There can be some dark days and some difficult days in this work. But knowing that there are other people who are sharing those burdens and fighting that fight is just immensely energizing and supportive.